This study looked at cognitive-based training using an app. Now, I know that people have heard of the Brain HQ app. You can download it from the App Store, and it's basically a subscription-based application, but there's a bunch of different brain games on it. Most of the previous studies have found that usually people that do these type of brain games like Lumosity and things like that, generally they just get better at doing those games. They don't get better at true cognitive function. They just learn the game and they get improvement at the game because they've done it a bunch. Well, this study tried to use Brain HQ as an actual intervention as cognitive rehab. And so what they did is they hooked up vets, so military vets with history of concussion that had ongoing cognitive complaints and mild cognitive impairment. And they basically assessed them and gave them either Brain HQ app, or they gave them a placebo or an active control type of scenario. So instead of doing Brain HQ, they were given things like Mahjong, and they were playing card games, and they were doing other things that could be perceived as cognitive rehab. So it was a blinded study, meaning that the control group thought that they were actually in the experimental group, which is, that's a good way to do the study. And they did 5 days per week, 1 hour per day for 13 weeks. And they were given like a coach that they checked in on and everything like that. And the experimental intervention was a brain plasticity-based computerized cognitive training program, which was Brain HQ. They did it on a computer, though, not on an app. Targeting speed and accuracy of information processing, and the active control was composed of just basic computer games. Primary cognitive function measure was a composite of 9 standardized neuropsychological assessments. So they were looking at actual neuropsychological tests to see how their cognitive function improved using these particular measures. Treatment group showed an improvement in the composite cognitive measure significantly larger than that of the active control group at both post-training and at a 3-month follow-up period. So after the 13-week training program, they went through a 3-month period, kind of a washout period, where they didn't do any cognitive rehabilitation whatsoever. And the treatment group still stuck, where they still maintained their cognitive improvements. So both large and small cognitive functional improvements were seen twice as frequently in the treatment group as that in the active control. So again, I break this down. Double-blind, placebo-controlled, randomized control trial. They had 83 people included with mild cognitive impairment. They were enrolled between 2013 and February 2017. The mean time since concussion was 7.3 plus or minus 6.5 years. 12% were also doing other types of rehab at the time of the study. They found no significant differences between the groups before the intervention started, except there was 2 cognitive scores, which they actually ended up using as covariates. So they kind of excluded those differences in the post-treatment model. They assessed subjects on the following domains pre and post intervention. So they did cognitive measures, and they also did functional measures. So they did a neuropsychological battery to look at their cognitive measures, and they did something called the timed instrumental activities of daily living, as well as a self-report measure, the Beck Depression Inventory, and the PTSD civilian checklist, and some other ones to look at functional outcomes. Interventions, like I said, 1-hour sessions, self-directed, 5 days per week for 13 weeks. Intervention group was given Brain HQ. Control group played games like Hangman, Boggle, Mahjong, etc. So this is Brain HQ. Some of the games you can see sample of what kind of exercises they were doing. And then this is active control. So this is like they're playing Tetris here, essentially, right? So they could be perceived as, rehab, but in fact, they don't really have any therapeutic benefit to them. Whereas these ones are designed to have some sort of therapeutic benefit. After the intervention, significant difference in cognitive composite scores, but they didn't have any differences on any other functional measures. So their neurocognitive assessment battery was 3.9 times greater in the treatment group at the end of treatment. 3 months later, they were 5 times greater than the control group. So that should say, 5 times greater in the treatment group. So even after 3 months. Now, here's where things get tricky from a statistical standpoint, because when you look at this, so here's the difference, right? This is active control, and this is the treatment group. Active control, treatment group. So this is post-training. This is at 3-month follow-up. This is functional. So you can see here, when you look at the line in the middle, that's the mean difference. You can see here that these are pretty much identical, and the box plot is pretty much identical. And you can see the grouping here of everybody. These are all the individuals, pretty much identical between the two groups. Same thing here, active control, and then the treatment group, basically the same, no real difference. So no difference in functional. Now you can see here's the mean here of the active control. Here's the mean of the treatment group at post-training. You can see the mean is different, and the boxes are overlapping slightly. And you can see here that the groups, like on an individual level, you're probably not getting that much therapeutic benefit. When you look at the group as a whole, if like 3 people get better and the rest kind of stay the same, overall, your group as a whole is going to show a significant outcome. But when you look at the actual individuals here, there's really not that much improvement, right? You would expect to see, like look at these. Here's the overlap here. So the lowest here, you have a cluster of really low people here. Then you have this big meat here in the middle, right? And then you have a cluster of people up here that are doing really well, right? So more people down here not doing as good, and more people up here doing better. But these 3 people are really kind of swaying everything to pull up, right? And not having this cluster down here is really swaying things up. So again, even though the study shows that it's good, you still have tremendous overlap between these 2 groups. So is this actually going to be beneficial for every single person that does it? Probably not, right? Now, could it be helpful for a couple? Yeah, these 3 people got really good, right? So I think it's just something to keep in mind when you're looking at these types of studies, even though the results show, 3 times greater improvement in the treatment group. That's overall as a whole, but you can see here the individuals and how they're dispersed and pretty much identical through both groups. So anyway, also the study was funded by the developers of BrainHQ. Every single author is like a paid employee or whatever. So there's major conflicts of interest on this study. So I just wanted to show that.